I'm Cora Constantinescu. I'm a pediatric infectious disease specialist. In this webinar, we will do an overview of vaccine hesitancy around the COVID-19 vaccine, and we'll also discuss a few principles of effective communication that can tackle this hesitancy around the vaccine. Our aim for our healthcare workers is to get educated, get vaccinated, and get skilled at holding the vaccine discussion. Right now in Canada, we have almost 1 million doses that have been administered. Even more than that have actually been delivered to the various provinces and territories. Despite all this, however, we know that overall the willingness to be vaccinated among Canadians is still not where we'd like it to be. The Angus Reid Group has actually been looking at this since mid-summer, and they have done multiple surveys through the fall and early winter. In the beginning, around July, about 46% of Canadians were willing to get a vaccine as soon as it was available. This dipped a bit in September and then has had a small increase. Most recently, in January of 2021, 60% of Canadians were willing to take a vaccine as soon as it was available to them. We also know that this can actually correlate with the perceived concern that people have around COVID-19 disease and the threat to them. So if there is no concern about this disease, then people are less likely to get vaccinated, as opposed to those who are concerned about the disease and the personal threat to them, for whom they are much more inclined to go ahead and have a vaccine as soon as it's available to them. Depending on different mathematical models, we can actually calculate, based on the effectiveness of a vaccine, where we would need to be in terms of uptake to reach herd immunity or community protection. For something like an mRNA vaccine, which is shown to be around 94 to 95% effective, we would need 70% of our Canadians to take the vaccine to reach herd immunity. In our country, that gap is around 3.7 million people if we look at a 10% gap. Therefore, we're talking about millions of people that we need to reach to ensure that we can support to make the vaccination decision. What we also know is that being a healthcare worker still can come with vaccine hesitancy, and some studies show that irrespective of whether or not the respondents are healthcare workers or not, they may still have only about 60% intent to take a vaccine as soon as it was available to them. Overall, if we're going to look at reasons for vaccine hesitancy, the WHO, even before COVID, looked at the 3 C's of vaccine hesitancy around confidence, complacency, and convenience. For COVID-19, confidence around the vaccine has to do with safety or concerns about safety, but also trust. Trust in healthcare workers, trust in health agencies and governments. Issues with complacency have to do with the perceived risk of the disease versus the benefit of the vaccine. So for example, a simple way to look at complacency is to say that if you are a COVID denier or a believer that the pandemic is a hoax, you're not going to be likely to have a vaccine because you don't perceive the threat of the disease. However, what we have also found in our own research is that people can feel so complacent with their public health recommendation compliance that they feel safe in their isolation bubble. So they feel that they are so good at following public health recommendations that they're not at risk of the disease, and therefore they're less likely to want to take the vaccine. Issues around convenience have to do with accessibility of the vaccine, but also in some cases, such as healthcare workers, they may perceive that if they have the vaccine and have an untoward event, like a sore arm or fatigue or a fever, they may not be able to come to work. And if they don't have sick days to account for that, they might be less likely to want to take the vaccine out of fear of having to miss work. More recently, 2 other C's were added to this whole WHO model of vaccine hesitancy. One is calculation. Calculation refers to where people go for information around the vaccine. Around the COVID-19 vaccine, we know that if you're less likely to have the vaccine, you're also more likely to rely on information from social media, less trusted sources of information, less likely to go to places such as government websites, and more likely to rely on friends or family for recommendations. The last C is that of collective responsibility. This means that in some people who may not perceive the risk of the disease to them personally, they may feel they're only doing it to protect society. And again, it's important for us to know the reasons people have for vaccine hesitancy, because it's going to help enable us to do the right messaging for people so that the message we put forward resonates with them and their own reasons for hesitancy. So what do we know about vaccine hesitancy and vaccine communication? We do know that concerns and denial are natural, and denial doesn't stem from ignorance. Commonly, people don't reject facts because facts are untrue, but because the facts don't apply to them. We also know that in order to overcome vaccine hesitancy and promote vaccination behavior, we need to not just address misinformation, but also address the emotion that comes with that decision and the trust that people have to have in their healthcare providers. Many things have changed over this pandemic, but we know that the one thing that hasn't is that healthcare providers are still the most trusted source for vaccine information. So it's important to know that when you're dealing with your patients. When it comes to effective vaccine communication, there are a few principles you can follow. Keep the information simple to understand, and keep in mind that people make decisions around the gist of the information you pass to them, and use simple numbers. For example, the gist of vaccine information focuses on the fact that the vaccine is safe, the vaccine works, and there is a personal as well as an economic risk to COVID to each and every one of us. And the vaccine is the solution for a way out of this pandemic. That would be the gist of the vaccine information when you hold a vaccine conversation with your patients. This is an example of how you can simplify the side effect discussion around this vaccine. You can use simple numbers such as 8 in 10 people complain of a sore arm, but only 1 in 100 call that soreness severe. 5 in 10 people complain of fatigue and headaches, but only 1 in 10 would need Advil or Tylenol to tackle that. There is some reaction to that vaccine to be expected, but the majority are mild and easily manageable at home. So using simple numbers and putting it in the context of real life helps keep the information still true and accurate, but much more understandable to their patients and even to our colleagues and families. Also, when you speak around pain around this vaccine, it's important to use the right terminology. We know that from a meta-analysis of 35 studies, avoidance of influenza vaccine was related to needle fear in 16% of adult patients, 27% of hospital employees, and 18% of workers at long-term care facilities. So needle fear can definitely contribute to vaccine intent. This is an important factor in the COVID-19 vaccine because we have all heard of multiple reports of reactogenicity. So you're more likely to have a sore arm, potentially from one of the mRNA vaccines, than other vaccines that people might have had as adults. So it's important that when we address vaccine hesitancy and we talk about vaccine promotion, we keep in mind that pain is an important factor. There are certain things you can do in terms of commitment to comfort principles, and this is our skip or solution for kids in pain. And they recommend that you create a comfort plan. So you ask if the person is about to be vaccinated, has preference around their comfort management. You can use numbing cream for the actual administration, but even before the administration, you can use simple positive language. This makes the person more likely to return for future vaccinations and therefore complete their series. And you can communicate in a way that reduces the fear and distress to immunization. So avoid saying things like, it will soon be over, or it will be okay. and rather talk about what they're doing well, such as you did a great job of relaxing your arm. And after they do have the vaccine, you can actually validate a lot of what they've done well. You can say, you did that really well, or by doing this today, you're helping to save lives, keeping yourself and others safe. So changing the language towards a more positive, validating kind of language around that. Even before each and every one of us gets a chance to contribute to herd immunity, we can start being champions for this vaccine to contribute to herd influence. Thank you. And for the next webinar, join me when I talk to you about the PROTECT plan, which is a simple communication plan that you can use in your practice with your patients, with your colleagues, and even with your family and friends. Thank you.